I'm Alice Gonzalez. I'm project manager at the Fundación TIC Salut Social. So we are an entity of the Catalan Ministry of Health, and we work to facilitate the digital transformation of the healthcare and social care system in Catalonia. So I'm very happy to be here representing the Catalan adoption site for this xShare project. So to give a little bit of context of the Catalan sector situation currently in Catalonia, we already had in the public healthcare system, we had implemented the first version of a button allowing to citizens to download their health data before the start of the xShare project. But thanks to the xShare project, we have been working on the second version of the yellow button, focusing on improving the quality of the button and the generated document as the patient summary. And a key strength of the public system is that all records are centralized in a single information system, allowing this IPS generation for each patient in the Catalan system. But in the other side, in the private sector, which is widely used in Catalonia, the clinical data is more scattered through the centers, making that we worked with two different hospitals, and we worked to enable this IPS downloading in the patient portals of these two private hospitals. So in our case, this yellow button was especially relevant for the continuity of care between the public and the private sector. As I said, it's very common for the citizens to receive, for example, faster specialist care in the private sector, but still rely on the public system for other services. And the problem is that the clinical data doesn't flow between just two sectors. So to illustrate this, we created during the xShare project this persona called Julia. Julia gave birth, for example, in a private hospital, and now her public primary care doctor has no access to the information about this intervention. So Julia needs to go to the private hospital portal to download her IPS and upload it via La Meva Salut, which is the public patient portal in Catalonia, to update this public record. This clinical data record. So yes, these IPS should include all the information that we developed in the persona file. So in the plugathon, what we did was to validate the first part of this scenario, which was the downloading of the IPS from the private system. So what we did before was, as I said, to develop this persona of Julia, and to generate the IPS generation in FHIR format. We also have the CDA format, but we have the option of the FHIR format downloading too. So we didn't need to transform it thanks to the xShare tools that were developed. We work with the system of the Clínica Girona, which is one of our private hospitals that collaborate with us. So what we did in the plugathon was to verify the conformance of these IPS using the Gazelle validator to ensure that the compliance with the implementation guide for the FHIR IPS, and also this manual verification through the facilitators that reviewed all the contents of the IPS to check the consistency with the persona, that the information was clearly displayed, etc., etc. And finally, we also did the testing of the download capability via as I said, the private hospital app of the Clínica Girona. So this validated that a real person can log in the patient portal, authenticate, select which document to download it in the FHIR format, and basically that's the core requirement of the silver label, and this is why we got the silver label for that. So this is a big milestone because it shows how our private system allows citizens to access and take control of their data in a structured format. And we also did something that was optional, but we are very happy of this also, was the cross-site sharing with our partners from Hellas, which were acting as content consumers, so they could display this IPS from another site. So yeah, this is as a next step, we might want to validate this viewing of the IPS with the IPS reward that we are being developing throughout the xShare project. But this might be as a next step of our activity. So next slide, please. So as we validated all those things throughout the plugathon and we got the silver insignia, we came back with a lot of feedback, and for us it was a very important learning moment for us. It showed how, well, first of all, that we are technically capable of producing and reading these IPS in FHIR format in a real word like testing setting situation, but we also saw that we have only validated one part of the loop. As I said, we still have, we have validated this downloading from the private system, but we need the next step, which is to complete the data upload in the public system, where the doctor can see the information, basically. So this is the next step that we will work on. And also as a next step is to work on the gold insignia. To attain this gold label, the organizations must complete all the silver level validation. So this is okay. And now we will, well, as manufacturers, there is this need to engage with officially recognized regional authorities. For example, as TIC Salut, we have this experience in doing that. Because the idea is to demonstrate this real-world integration into trusted healthcare networks. So an interesting point in our case as Fundación TIC Salut Social is that we are in both cases, both in the adoption site representative and also in the sharing our experience as regional health authorities, and gives us this very unique opportunity to ensure the quality of the implementation of this gold label. So we are facing very, very interesting following months in the project. And yeah, so we bring from our experience in the plugathon, we've seen how the requirements that were defined in Work Package 9 for the whole labeling process are now implemented and verified with the use of very interesting tools like Gazelle, with the facilitators that provide feedback. So so yeah, we also had the opportunity to learn how to use this Gazelle tool, which gave us a lot of knowledge in this sector. And yeah, it was a very great chance to learn by doing, by sharing with the other adoption sites, and yeah, move to the next step, closer to this implementation of the yellow button. So we are very happy for that.